Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Qudsia Anjum Qureshi. I am consultant anesthetist. Currently, I am heading the Department of Anesthesia, Rawalpindi Institute of Cardiology. I am a certified AHA BLS instructor under the umbrella of Shaheed Zulfikar Ali Bhutto Medical University, which is an international training center accredited by American Heart Association for BLS training. Diagnosing the arrested victim, how CPR is done, how BLS is provided. BLS is provided by immediately starting compressions on the victim's chest. The BLS provider places his hands on the victim's chest, on the breastbone. Breastbone is a bone which is extending from the neck in front between the rib cage. So the BLS provider places his both hands on the lower end of victim's breastbone and starts compressing the heart. Compressions are provided at a rate of 100 to 120 compressions per minute. And what actually happens with these compressions? The main crux is that the heart is compressed between the breastbone and the vertebral column. These two tough structures, they actually compress the heart, and whatsoever blood is present inside the heart, due to this manual compression, this blood is pumped into the aorta. Then in the next compression, the blood which comes back to the heart, that is again pushed. And this cycle goes on and on till the compressions are continued. The rate of the compressions is kept between 100 to 120 per minute. Why is this rate calculated to this range? The researchers, they keep on evaluating the efficacy of basic life support provided to the victims of cardiac arrest in the whole world. And every 2 years, they actually retrospectively pursue how many victims they have been survived, how many have been transferred to the hospitals, and then they were able to be discharged after the initial or post cardiac arrest care. So every 2 years, they evaluate the efficacy of the BLS provided, and then they actually devise certain guidelines. So this rate of 100 to 120 compressions per minute has been devised for, and it has been seen that the victims who have received chest compressions at this rate, they have got more chances of survival, and they have got more chances of discharge from the hospital after their initial cardiac arrest. So the compressor provides chest compressions at a rate of 100 to 120 compressions per minute. This much amount of blood is enough to keep the blood, to keep the brain and the heart in a condition, in a position whereby further advanced life support can guarantee the survival of the overall survival of the arrested victim. The most important thing is anybody can be a BLS provider. Anybody, by anybody I mean you can be a doctor, you can be a paramedic, a nurse or a technician, you can be a ward boy, even a sweeper working in the hospital setup, or a layman. You have got nothing to do with medicine or any allied healthcare facility, but you can become a BLS provider. You can become a certified BLS provider by getting yourself registered to the international training centers in Rawalpindi, Islamabad, Shaheed Zulfikar Ali Bhutto Medical University in PIMS, and Armed Forces Institute of Cardiology. They are certified international training centers for AHA BLS. You can get yourselves registered, and they usually hold routine, regular BLS courses, and anybody can become a certified BLS provider. Remember, to serve humanity, you save one human life, you save the whole humanity. So it is not necessary that you have to be a doctor or a nurse. You can become a BLS provider by getting your skills polished through these BLS courses. In BLS Basic Life Support course, you are provided with this manual which has got all necessary information about the BLS techniques. You are provided with this pocket card. The BLS providers, they are having these pocket cards. These are called algorithms. You can quickly consult with these, and you may be given this pocket mask. So if you can save your near and dear ones in a party, in your home, in a school, in an office, if you save one life, save the whole humanity. Thank you.